Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. As you notice, I just took off my mask because everybody in our studio has received the vaccine, and I always wear my N95 mask. I just want to remind you folks that it might be something that you want to demand, wearing your mask. Maybe not demand, but suggest that you might want to take in all the information and protect you and your families. We have two wonderful guests. This is a very significant program that we have in Florida, and particularly in South Florida. It's the South Florida Transplant Center at Broward Health. It's something which is very, very special. And let me introduce to you Krystel Nava, who's an RN. I see all the acronyms after your name, Nurse Krystel Nava. So tell us what those mean. Because you're the regional director of the transplant services at the South Florida Transplant Center at Broward Health. So go ahead.
Hi, good morning. Thank you so much for having us. All the little letters after my name, I'm a registered nurse. I did obtain my bachelor's as a registered nurse, and I'm also a certified clinical transplant coordinator, which is the C.C.T.C part that you see at the end of it.
So before we get to Dr. Shaw, tell us what the center is all about.
So really what's all about is our patients. Every decision that we make here is for the benefit of our patients. They're at the center of all the decisions, and everything that we work hard for to strive for excellence is for their long-term outcomes and for them to have a better quality of life. Here at Broward Health, we were the first liver transplant program in Broward County back in 2004. And recently we have launched our kidney transplant program earlier this year to better serve our community, and that transplant community full of patients that are in such great need for transplanted organs here in the area and the county.
So now we have Dr. Joshua J. Shaw. Dr. Shaw, you're the kidney surgical director, and you're with, obviously, the South Florida Transplant Center at Broward Health. So welcome. We're glad to have you.
Great. Thank you for having us.
Tell us about this. I guess it's, in essence, it's a new venture. The kidney transplant comes in and joins hands with the liver transplant unit. So tell me about the Kidney Transplant Center.
Yeah, so, it's a new venture for Broward Health, but, most of the people, including myself and all of the other folks who are involved with the kidney transplant team, had been involved with kidney transplant at other centers. For us, it's exciting. We got our provisional approval in December. We opened our doors in January of this year and did our first transplant in March, and have been picking up steam ever since. Where it's really great for the community. Patients have local options if they need a kidney transplant. Those are patients who are on dialysis or patients who will likely need dialysis in the near future because of, a variety of different diseases that all end with patients being on dialysis.
Well, let me just touch on that for a minute, because, as I usually open the show, I tell the guests that the questions or the reason why you're here is because there are questions by the viewers. The people that ask the questions asked what might sound oversimplistic, but what leads to, you touched on it, but for example, one of the viewers asked, well, I produce kidney stones. I've been told that I might need a kidney transplant. So that's a question that came from a viewer. So why don't we get into some of that? It's all yours, Dr. Shaw.
Yeah, so, there are, literally about 100 different diseases that can result in kidney failure. Just to keep it very, very simple, but think of abdominal pain. It's a symptom of something. End-stage renal disease, or when your kidneys fail, can be a symptom of a greater problem or a constellation of problems that somebody has. So, to the viewer who asked, can kidney stones result in renal failure that would require a kidney transplant? It's rare, but there certainly are individuals who have certain congenital or hereditary problems that result in kidney stones and ultimately renal failure. And those individuals, absolutely, a kidney transplant is one potential option for them.
Let me also, a point was brought to us by one of our viewers that said that, we have a lot of, I don't want to say, let me make this point. We have a lot of folks in the state of Florida. We are the largest state of people over the age of 75 in percentage. We are the greatest state in the union of people over 80 in the United States. And God bless them. I'm at that mature point. We get these questions, and the question about kidney stones was not the only question. There was a plethora of questions relative to, I've had prostatitis for X number of years, and it's very difficult for me to urinate, et cetera, et cetera. Is this because my kidneys are not functioning correctly, or is it because I have to go back in and have another, not a prostatectomy, but another reduction in the prostate? Those are the kinds of questions that we get. So I'm throwing it to you. Go ahead.
Sure. So let me take it from sort of the what you first said. So at our center, we don't have an age cutoff. We evaluate every individual on just that, an individual basis. There are people, there are many centers in this country that will not transplant people in their 70s, definitely not people in their 80s. We will consider all patients if they are medically fit and healthy. The worst thing we can do for someone is transplant them and have it result in other medical problems for them as a result of their pre-existing conditions that are unrelated possibly to their kidneys. With regards to the other part where you said, if you have, it sounds like, BPH or benign prostate hypertrophy or hyperplasia, in those instances, is a kidney transplant going to fix that? In that instance, no. But there are a lot of reasons that, men or women, for that matter, can have issues with urination, and they certainly need to be worked up, because if it is a reversible cause of being able to go to the bathroom, urinate, if it's a kidney problem, it's usually the production of urine. But with BPH, it's an outflow obstruction. It's the inability of the urine to get from the bladder, through the urethra, into a toilet bowl. For those individuals, that is correctable. And in certain instances, if it's not corrected, it can ultimately damage the kidney. In those instances, if you don't correct it and you put a new kidney in, and you don't fix the original problem, the same thing will happen to the new kidney. So, to what I said for the first question, it's really on an individual basis. There's a lot of reasons why someone can have, urinary hesitancy or retention, and we need to make sure that as part of the kidney transplant workup, we have a full understanding of why that is for that individual. And unfortunately, there are a lot of different reasons you can have those types of problems. And again, the symptoms will look the same, but the reasons for why they have them or the etiology behind it can be very different.
Dr. Krystel Nava, I took nurse professional Krystel Nava, and I majored doctor, but I guess a lot of people live with your knowledge. Being the director of transplant services is really a very, very difficult task in a sense, but you come into an entity that has some very strong history on liver transplants. So why don't you talk about that for a minute?
Being at the center of everything that we do here, as you said, it's a major task, and it's something that it's really busy every day. But I am lucky enough to be able to be surrounded by a team of physicians, like Dr. Shah mentioned, that has a lot of history and a lot of experience in working with kidney transplant patients and liver transplant patients, as well as a very good dedicated team of nurses that have a lot of experience, social workers, nutritionists, pharmacists, and everything we do as a team. And you rely on the expertise of not just myself and the physicians, but everybody in our team. And we learn every day from each other as to what we need to do to make each day better for the patients and do all of the things that we need to do for them. So they definitely make it easier for me.
Well, one of the things that I think makes the job a little easier, and this is just a personal opinion, is that there's always been a dedication from the leadership. I'm talking about the executive leadership of the hospital, and you couldn't have a better situation now with Mr. Shane Strum. Go ahead, my doctor. I'm sorry, I keep making you a doctor. I don't. I'll make. You're almost a doctor. Go ahead.
She's smarter than the doctors.
I was just going to say, I couldn't agree more. You know, in order to be successful at something that you do at any institution, especially when it comes to a transplant program, you need the support of not just your immediate team that's next to you, but of different providers here in the hospital and the leadership team. And we are very, very lucky to have Heather, our CEO, to be behind us and pushing us every day. Our AVP of Service Lines, Teresa, and Mr. Strum as well. He's very excited about transplant and very much on board of helping us continue the journey that we're on and growing and becoming the best center that we can become.
Dr. Shaw, there's another thing. We had a multitude of questions, and I'm sure that it's a reason for some kidney failure, I believe, but a lot of people with insidious diabetic problems. Would you want to talk about that for a minute?
Sure. So, you know, diabetes is one of the most frequent diagnoses that we see in our patient population. You know, diabetes, hypertension, obesity, they're all diseases of chronicity. They don't kill you overnight, but they slowly over time damage different aspects of your body. And with diabetes, it's, you know, one of the things it does is it destroys small vessels over time. It will eventually destroy an individual's renal function. And, you know, it's not a guarantee for every diabetic out there. They're eventually going to have their kidneys fail, but it is very, very common. I would say in about at least 80% of the patients we work up for kidney transplant, they have one and or all of diabetes, hypertension, and obesity. Those are all three very large contributing diagnoses that can potentially lead to end-stage renal disease and ultimate renal failure.
And obesity is something which has it's moved down the charts relative to age. I mean, obesity levels at high school age are frightening. So I wonder what your thoughts are on that. You already made the point about they show up in life, but it's really almost frightening.
Yeah, and it's unfortunate, but you know, to your point, and we actually see this in liver transplant as well, as obesity has actually taken over one of the number one causes for why we're transplanting people, actually for kidneys and for livers at this point. Obesity leads to a lot of other problems. Diabetes and hypertension are two of them, and also to your point, we're seeing it younger and younger. I mean, you know, they're doing gastric bypass on teenagers now and on children, which is pretty extreme to be doing that. And I think culturally, it has a lot to do with that. We've turned into not everyone, but into what I call a microwave popcorn society, where where people go to McDonald's, they go to various places as opposed to eating wholesome food, sedentary lifestyles. Those things are, in the current climate, it's very difficult for people to maintain active and healthy lifestyles. And, the consequence of that is literally all three of those things: diabetes, hypertension, and obesity. And like I said earlier, they all have end pathways that, hypertension leads to atherosclerosis, and it's cardiac disease, heart attacks. In fact, that's the number one reason patients with kidney transplants die. It has nothing to do with their kidneys. It has to do with their hearts. Obesity and diabetes also are prone to those things as well. So it is an epidemic in this country, and where we are, I think right now with COVID and everything else going on, we got to pick and choose what our battles are, and some of that starts with education of the youth. I know there've been multiple programs about not stopping physical gym classes and things like that in schools, but when budgets get tight, those are usually the first things to go, and that translates to adults who are not active and suffer from those problems. So there are significant downstream effects, but you're right, we're seeing it with much younger and younger populations.
To Dr. Shah's point, obesity has truly become a real issue and a pandemic that's very big, not just here in the US, but worldwide. And like he said, it's becoming one of the number one reasons as to why we have to move towards transplant, not just with kidneys, but also with liver patients. So from a nursing standpoint here at Broward, one of the main things that we do with our patients that come in, it all begins with education. We get through them through transplant, and we continue post-transplant with educating our patients on how important it is to live the healthiest lifestyle that we can live, because those diseases that cause them to have that initial kidney failure or liver failure, they can come back if we don't modify those behaviors or take care of the disease that caused that, such as diabetes. And one of the big things that can lead to that is obesity. So we focus a lot on education on our patients here, and we educate them throughout the way and years post-transplant to try to give them the best chance that they can have long-term.
Let me ask you this question relative to that, because, there's been a tremendous, and I think it's proper, spotlight on nutrition, all right? And I just wondered that in your aftercare, in other words, I'm sure that there's a whole program of aftercare, whether it's liver or kidney.
Yes, absolutely. We have registered dietitians that are licensed in the state of Florida who are very qualified and have a lot of experience. They actually see our patients from a pre-transplant perspective and make sure that they understand and they get a good grasp as to what their current lifestyle and nutritional status is, to see if we need to adapt to that and do anything differently at the time of surgery, post-surgery, and see what kind of education they would need. The patient gets followed all the time, all the way through their transplant surgery and their transplant stay. We make sure that at that point they get re-educated on everything that they will need to do post-transplant. And for both organs, really, liver and kidney, we follow our patients very, very closely. And every time they come to clinic, we have nutritionists and pharmacists available and social workers available on top of the team of nurses and physicians that actually sit with the patients as often as it is necessary to make sure that they're not only getting the education and resources they need, but that they understand why they have to do those things and kind of modify the plans for them if we need to as we go along in their recovery process.
The reason I brought it up is because, and I'm sure Dr. Shaw is very pleased of what you just said, is that, I use it as sort of analogous. We've come to a point where medical science capabilities just don't do their work and let people go. We don't give them a pair of crutches or a cane or a walker and just say, go do it. We're offering them additional services, which really, when you really think of it, when open heart surgery was done, and then now we're doing so much stenting, et cetera, we have so much cardiac follow-up and cardiac care centers. That's why I asked the question. So Dr. Shaw, I'm sure it must be very favorable to your position as a kidney surgical transplant doctor to know that the patients are cared for after you have done your miraculous work?
You know, for me, that's great, and I think as a culture, as a team, we want the very best for our patients, which means, you know, you can't just treat one little problem at a time. We have a multidisciplinary team approach, and that includes everybody from our nephrologists, our patients, their families, you know, as Krystel said, you know, our registered dietitian, pharmacists, social workers, physical occupational therapists, to make sure that our patients succeed. You know, if you just put a new kidney in people and send them home and tell them these are the meds you take, you know, you'll reach some baseline level of success. But if you treat the whole person beyond just their renal disease, but to make sure they're properly educated, to make sure we optimize everything we can, that their diabetes, their blood pressure, all of those things are under the best possible control, you'll wind up with the best possible results, which translates to patients living longer and their kidneys lasting longer. And that's what we've seen throughout time. And it's, you know, here at Broward, we round as a multidisciplinary unit multiple days a week to ensure just that nothing falls through the cracks with our patients. And, you know, as the surgeon, you know, my job obviously is to make sure that we get them through the surgical aspect, or from the time they're transplanted to, you know, moving forward. But after about a month or two after their operation, you know, my role becomes much more limited, and we rely more heavily on my medical colleagues, our nutritionists, our pharmacists, everybody else who does their part to ensure that the patients do well.
Well, you know, again, I have great good feelings about the transplant center at Broward Health, because I know the mantra, and that is care throughout their lives. And I think it's important that what you just said. It's really heartwarming to know that what Krystel Nava said and what you have followed up on, because that's really the essence of success for the longevity of these individuals. People who live, when I use the terms about people being here over the age of 75 and over the age of 80, you got to remember, we have the survivors. South Florida is loaded with medical survivors. They've been able to get through an awful lot. You know, it's a wonderment that we've extended our view from age 65 to now, you know, 85, as I see it, from a lot of the literature and otherwise. It's very valuable to the people who watch this show to know that the care is there and it's available to them. Krystel Nava, you must have an awful lot of community cooperation, I would hope. Of course, and now with the pandemic, it makes it very difficult for your team or otherwise to give lectures and communications to condominium associations, ALFs, nursing homes, et cetera, et cetera. Is that correct?
Yeah, it's a little bit more challenging now. Obviously, with the pandemic, we all want to make sure that we are keeping the patients safe. By doing that, we need to keep us, the caregivers, safe. So it's a little bit harder to kind of do that one-on-one time and face-to-face time that you normally would have with your community partners. However, we're still keeping in touch, you know, through Zoom meetings and team meetings and things like that. You're able to kind of stay in touch and share new information as needed. We are still working on doing some patient education in some community dialysis centers, just to try to keep them educated and, you know, have the community learn more a little bit about Broward Health. With that said, there were talks about bringing back some patients and community involved events, such as the National Kidney Foundation Kidney Walk later this fall, and those are still in conversation. So hopefully we can make those happen and be able to get out there with our community.
I want to thank both of you for being here today. These were questions really that came from our viewers. I personally am very proud of the center. We're very thankful, Krystel, Nava, RN, B.S.N, C.C.T.C. You're the Regional Director of Transplant Services for the South Florida Transplant Center at Broward. And Joshua Shaw, thank you very much for joining our community and being the Kidney Surgical Director. Thank you both very, very much.
Thank you very much for having us.
Thank you. We truly appreciate the time.
Thank you very much. Remember, folks, this program comes to you from Nova Southeastern University. You have any questions or comments, there's a telephone number and otherwise. And remember, I always tell you, take good care of yourself. You have a problem, tell your doctor. Don't let it go by. Tell your doctor. My name is Fred Lippman. Come to you from Nova Southeastern University. This is Dateline Health. Until next time, see you.